I'm here with Brianne. She's an excellent hair loss specialist here with us at Vito Mazza. And Brianne does lots of different things in our area for thinning hair. So I just wanted to get an idea, if a client came in with some hair loss issues, how would you evaluate them and see what type of treatment we could offer them to help?
Normally when a client comes in for the first time, I try to get an idea of what their needs are, how their hair loss started, has something changed with them physically or with a medication, and I try to assess from there what would suit their needs best. We have a couple different hair loss programs here, so I try to fit them with what their needs are.
That's excellent. So someone comes in, let's say, for medical hair loss, maybe they're receiving cancer treatments. How could we help a client like that? You know, maybe it's just a temporary hair loss situation. What do we have to offer?
Well, normally in that situation for a chemotherapy patient or someone undergoing medical hair loss, would talk to them about wigs, which are a temporary solution for that type of a hair loss.
So let's say a client comes in and, you know, maybe they're undergoing chemotherapy treatments and their hair loss might be temporary. How would you help, you know, a client in that type of situation?
What I try to do is walk them through the process of picking out a wig. I try to go off of if they like their current hairstyle, if they're coming in still with their hair, and I try to really organize what they're going to be wearing after their chemotherapy treatments start kicking in. If they want to look close to their hairstyle or do a different change, something completely different, and we just kind of consult and talk about what their needs are for their treatment options.
So you're so talented. I mean, you also can do, you know, the non-surgical hair replacements. You work with the wigs, and then you help clients with laser as well. So tell me a little bit about when you're consulting with a client for laser.
When I'm consulting with a client for laser, usually the best candidate for that would be someone who's in the beginning stages of hair loss, men or women. If their hair is just shedding a bit and they're looking for something to maintain their hair naturally without any side effects, laser would be a great option for them. It also is very helpful for someone who's undergoing genetic hair loss or female or male pattern baldness. Laser really helps throughout that process and, like I said, maintains the integrity of the hair.
So Brianne, tell me, what type of clients have you been able to help, you know, through your time in the thinning hair department?
Well, there's a lot of different clients with a lot of different needs, and I try to treat each client for their specific needs. And what's happened is it's been a really great process to see someone through the beginning to the end of even the laser treatment. You see someone coming in with really fine hair and someone who's struggling and upset about their hair loss, and to see them, you know, a few months later get a lot of their hair back and start feeling confident again, it's really a nice process to be a part of. And then you have some clients whose hair loss is temporary because of chemotherapy, and that's even more exciting to see the hair grow back through those times, and, you know, to shape their hair up and help them start feeling better about their new growing in hair. The process has been really wonderful to be a part of.
I can say that it's definitely rewarding to be able to help clients when they're at a loss, you know, and just feeling, you know, like they don't look good, which obviously makes you feel like you don't feel good. And sometimes they don't feel good also, but to help to make them look good in that process is also, you know, very rewarding, I would think, for you. And you're so talented doing it, so
thank you.
We're so thankful that you're able to help people.
I feel very blessed to be a part of the process.